Good afternoon, everyone. Warm greetings from Narayana Hospital, Howrah. Today, myself, Dr. Sumana Datta, and Dr. Meenulochani will be speaking about a couple of topics regarding breast health. We all know that October is the Breast Cancer Awareness Month, and today we are here to share with our viewers certain insights into the importance of breast health, certain common problems that we encounter, how to go about breast screening, and what if anybody is diagnosed with a breast problem, be it a benign or a malignant lesion, what are the treatment modalities that are available. So I'll now start with Dr. Meenulochani. I'll start with the first question, that is, how important is breast health for women? And yeah.
So very good afternoon to everyone attending the session and greetings from Narayana Health. So this October, while we have our breast cancer awareness month, we are going to talk about how important is breast health and why is it important? Why are we talking about breast health today here? So the thing is that breast cancer is the most common cancer, not just in India, but all around the world. So this is the number one cancer affecting men and women both together. And in women, it is the most common cause of a cancer death. So how important is breast cancer is the reason that we are talking about breast health. And the second thing being, it is not all bad news. The good news is that breast cancer, when detected at an early stage, early detection gives them a chance for survival of up to 95%, where we say breast cancer is almost curable type of cancer. So in that case, it is very, very important to know how important the early detection in breast cancer is. Having told that early detection gives a survival rate of more than 90%, we will have to be vigilant about how we are going to do the early detection. And that is done by very few methods, like which are very, very simple and
Yeah,
can be done by everyone. So that
we'll
is
go over
the,
that over the
yeah.
later half of the talk. Now, we know women usually come to seek a consultation with the medical team. Usually, when they have most three common most problems are either a breast pain or a discomfort. Second being a nipple discharge, and the third being obviously the scariest thing, the lump, which everybody is a little scared of. So now let's just go over what are the just in brief, what are the usual most common causes of these three in young women and in slightly elderly population, more than 50.
All right. As far as the breast is concerned, women usually don't go to the surgeon or to the breast specialist. They go to the gynecologist. So that is exactly the reason why ma'am is trying to jot out the symptoms that they commonly go and meet a doctor with. So the thing is that a nipple discharge could be a milky discharge or a serious sticky discharge sometimes, which could be normal in young women who are lactating. They may have milky discharge, which is normal, and then just the pregnancy period or post-pregnancy having these kind of nipple discharges, we usually consider it to be non-cancerous. The other thing is the breast pain. Most of the people coming to the clinic with a breast complaint is usually pain in the breast. That is what they're most worried about. If it is pain, they are worried it could be cancer. But the truth is, this breast pain is caused probably due to hormonal changes that happens in their bodies. So any women having a breast pain, first thing is to think about a hormonal change. So when does it happen? When do we consider it normal? When a person is having a breast pain 5 days before the periods, it starts 5 days before the periods and then slowly reduces. And once the period is done, the pain completely goes off and they are fine after that. So this we call something as the cyclical mastalgia, and they get it every month. So this is common for every woman. So we usually tell them it's mostly hormone related and the treatment would be usually conservative. Nothing much. We just give them reassurance, a bit of analgesia, and then we say it should get better with that. But the elephant in the room, that is what we usually call it as the breast.
And also in the initial months of pregnancy, the first 3 months, it's usually one of the very common pregnancy symptoms. Patients sometimes don't go to the gynecologist, they go to a surgeon the other way around, saying because of the breast pain. That's absolutely normal. The first 3 months, because of this huge amount of hormonal changes during pregnancy, the breast pain is there. And nipple discharge also, up to a year after cessation of breastfeeding, some patients can see a milky discharge, which would be still within 1 year to 6 months would be considered normal. Now, the big query about women is breast lump. What to do and when, how do they approach?
Okay, so the problem with the breast lump is most of the patients, most of the females, ma'am would definitely know, would come and say, कुछ problem नहीं था, सिर्फ एक छोटा गांठ है. So they be like having a lump in the breast is so much normal, like it's a part of them. They take the advantage of that, saying it's just a breast lump. कुछ problem नहीं है, सिर्फ एक ही छोटा वाला गांठ है breast पे. But the problem is having a lump in the breast is not normal. It is never normal. So the thing is that earlier, more than 40 years, there is chance of breast cancer was said, but now it is not like that. The incidence is increasing. The incidence of breast cancer is increasing in India, and also the younger patients getting diagnosed with a breast cancer has increased. So there is a tenfold raise in people getting diagnosed with breast cancer. With this amount of incidence, we always think having a breast lump is the only major sign that the breast cancer gives, because most of the breast lumps are painless in breast cancer. This is something that has to be reiterated again and again. Having a breast lump which is not painless is could be a sign of breast cancer. So
Women should come before we see a lump. So there comes in the big role of screening. We always say screening saves lives. So how do women go about screening, and why is that? Can you just elaborate why is screening so important for breasts, and how do they go about it?
Okay, so the point here is basically early detection. So how do we early detect if there is a breast cancer? So there are two things, not just the screening by a mammography, but also a self breast examination. This costs you nothing and just takes 5 minutes to do. So anyone who is getting a breast lump or anything, how do you know that? By just doing a simple self breast examination at your place of comfort, at your home. It is going to just take 5 minutes to do it. So
we'll run the video that we have created for the benefit of our viewers, and we'll put that on.
Of course, yeah, we can go ahead with the video because we elaborated on how to do a
self then we'll go back.
Yeah, sure. Yeah, please. The team, if you could please play the video.
ये सच है, हर महिला की एक कहानी होती है और हर कहानी बेहद कीमती होती है. इसीलिए ज़रूरी है अर्ली डिटेक्शन, क्योंकि ये सिर्फ आपके नहीं, आपके पूरे परिवार की मुस्कान वापस लाती है.
I meet women every day who come to me late, sometimes too late, but you have the power to change it. It takes just 5 minutes to save your life. For the first step, मिरर के सामने खड़े रहना है. आपका ऊपर वाला कपड़ा पूरा खोलिए. स्टेप 2, आपका हाथ को साइड पे रखिए, फिर ऊपर करिए और वैसे कमर पे रखिए. आपका दोनों ब्रेस्ट का साइज, शेप, कॉन्ट्योर और फिर लिपर एरियोला कॉम्प्लेक्स एंड देन द स्किन ओवर द ब्रेस्ट, वो सब देखना है. अगर कोई लंप या कुछ स्किन चेंजेस वैसा कुछ आ रहा है कि नहीं, आप देखना है. स्टेप 3, द टच एंड फील मेथड. इसके लिए आप पहला बेड पर लेट जाइए और आपका हाथ से आपका पूरा ब्रेस्ट को चेक करके देखना है. फर्स्ट अगर आपका लेफ्ट ब्रेस्ट को देखना है तो लेफ्ट हाथ को ऊपर कीजिए और राइट हाथ से वो तीनों उंगली या चारों उंगली से आपका पूरा ब्रेस्ट को वैसे फर्म प्रेशर डाल के देख लीजिए until you reach the nipple areola complex. वैसे ऊपर से नीचे और साइड टू साइड भी करना है. The same way you need to just go to the axilla. वैसे थोड़ा नीचे कीजिए हाथ को और एक्सिला को भी देखना है बगल का कुछ गांठ है कि नहीं. The same way look at the collar bones के ऊपर वाला region, इधर भी देखना है. The step 4 is the same way you need to look at the right breast, axilla and the collar bones के ऊपर वाला region, the supraclavicular region. And step 5 is उठ के बैठिए और आपका हाथ से वैसे आपका निपल को थोड़ा प्रेशर डाल के प्रेस करके देखिए कि कुछ डिस्चार्ज आ रहा है कि नहीं, एनी पिन पॉइंट ब्लडी डिस्चार्ज, सीरस डिस्चार्ज, पानी जैसा पतला डिस्चार्ज, ऐसा कुछ आ रहा है कि नहीं देखना है। These are the 5 steps of self-breast examination.
Your health is in your hands, quite literally. Take 5 minutes today and gift yourself a lifetime of care.
All right. So this is the first part of how we can do an early detection. So who has to do it will be the next thing. Okay. Any female who has a breast tissue, no matter if it is 17 years, 18 years, they can still go ahead with doing a self-breast examination. Same way it can be done until they are 80, 90 years old, until the entire lifetime, a female can do a self-breast examination. The second part of this is the screening mammography, which is very, very important. We usually say doing a self-breast examination is not an alternative to a screening mammography, which has to be advised for every female who is beyond 40 years of age. Anyone beyond and over 40 years of age, we usually ask them to go ahead with a screening mammography at least once a year or twice. So we can do it annual mammography, screening mammography, just to check if there is any small changes, small lesions which are not palpable by hand during your self-breast examination. So a screening mammography detects a very small tumor, which is 0.5 centimeter or 1 centimeter. And this is the stage of breast cancer that we call the most treatable stage, the screening detected breast cancer. So as Dr. Sumana asked me rightly, what and all we can do for early detection. So these are the two main things: a self-breast examination, as we had depicted in the video, and then the second is a screening mammography, which has to be done for any female more than 40 years of age.
Would you like to elaborate for our viewers certain high-risk groups who might need to go in early for some screening, the screening test, certain sections of the population who might be at a slightly higher risk compared to the rest of the population? So what are those high-risk groups, and how early do they start screening? And are there any tests that are there any genetic testing which we know? Just tell our viewers that we can do with patients with a positive family history of breast or gynecological malignancies. So let's just delve into that.
Yeah, we can just touch upon that slightly. Where do we call a person as a high risk group for cancer? Is the patients who have a hereditary history or a family history, we say family history of cancers, not just any cancer. The relevant ones we usually choose is a breast cancer in the family, or a ovarian cancer in the family, or a prostate cancer for a male member in the family. So if these cancers are there, we used to ask them to get a genetic testing done just to know if they are at a higher risk. So there are many genes, but the most common ones that we choose here is the BRCA. BRCA1 and 2 are associated with a higher risk of getting a breast cancer. In these patients, what happens? In these patients, the thing is that we cannot do a mammography less than 40 years. We usually go with the ultrasound breast. The reason being, the density of the breast is very high when they are at a younger phase, 20s, 30s. The breast density is too high, so mammography cannot detect a lesion in that dense breast. So we usually ask them to go for an ultrasound. If the patient is a higher risk, we ask them to go for a 6-monthly mammography and MRI breast alternating. So they will do this every 6 monthly. Know if there is any changes happening in the breast. So mammography, ultrasound breast with a mammography or a MRI breast would be something that we advise for patients who are BRCA1 and 2 positive. And this is the 20% of the population. So 80% is going to be sporadic. So it is in the general population. Anyone can get a breast cancer. It is not associated with family history at all. Do not.
That's why the very important need for screening the entire population.
Yeah, exactly. So this 20% has a chance of getting a hereditary breast cancer through a BRCA1 and 2 mutations.
Yeah. So next, I think we'll just briefly touch upon as to how is the outcomes and when a person gets diagnosed with an early stage breast malignancy. a person who's routinely coming for a checkup gets screened by a screening mammography, gets picked up and comes to you?
Okay, like I said earlier, screening detected breast cancer is the most treatable form of cancer, where we say the survival is around 95 to 98%. So even apart from the stage 1 and stage 2 breast cancer, these stages we say survival outcome is 90 and 95%, almost close to 95%. The 5-year survival rate increases. So the early it gets detected, the more easier it is to treat the patient, and also there are chances of de-escalation of treatment, where a patient gets diagnosed, a screen detected patient having only a 1 centimeter or 2 centimeter small lesion in the breast. In those cases, we try to avoid chemotherapy for them. So this brings the de-escalation of treatment and the after effects of what could happen and things. So de-escalation plays a major role when we detect it early, not just the survival, but also giving them a better quality of life.
And also, you could go in for an organ conserving surgery.
Yeah, exactly. So this is something very, very important, where when we go into the surgical options, if the patient is having a small sized tumor, we can do a breast conserving surgery for them. So while talking about that, earlier the thing was that when someone gets a breast cancer, the entire breast has to be removed, and the what they feel from inside was very, very different. But now there is a lot of changes, where we see patients who actually want their breast to be conserved. We not just conserve the breast, we also do a reconstruction procedure. We do a plastic procedures along with that, giving them the same size and shape of the breast that they want.
So that's such an important aspect of a women's body image. So
exactly.
if picked up early, that also can be conserved.
Yeah, that also gives them a added advantage of de-escalation of treatment, and not just that, but confidence their
Yeah,
own
absolutely.
body. Yeah,
Feel confident in their own bodies.
exactly.
I think. And anything else that you would like to touch upon?
The only thing that I would like to reiterate again and again is that most of the breast cancer lumps are not painless. So if there is someone that you know, or someone who is not so open to come out and talk about breast cancer, I would ask you to please tell them that it's their body and they need to own it, and they need to know how important breast health is. Because when I say a cancer is curable, that is very, very important. And it is not something that is very rare. It's the most common cancer, and it can be cured. So what more would someone want? So just for the fact that if not talking about your breast and not taking care of your breast health would cost you a life. So if you could talk to someone, and if there is someone who is undergoing treatment or diagnosed with a breast cancer, you can tell them that how important it is to get treated. So breast cancer, when I say it's curable, you can go and tell them that it is not the end of all. So we can just go ahead with the treatment and things for them.
Now I think we'll take on the questions. There were a couple of questions that come in.
Okay. Okay, there's someone who's asking, does a pain in the breast always means cancer? So a pain in the breast is usually hormone related, and डरने का बात तो कुछ नहीं है. So we can definitely get it evaluated. A pain which is still present even after the periods, or if it's continuously there for 1 month, 2 months, still not subsiding. In these cases, we can do an ultrasound if they are less than 40 to see if there is any other small lesions or anything inside. So yeah, mostly the breast cancer lumps are not pain. Yeah, they are painless. The breast cancer lumps are painless.
And most of the pain issues are usually hormonal related, but other causes obviously we need to rule out. Can we? There was another question I think which we have almost answered. Can we avoid surgery in breast cancer patients?
Okay, completely avoiding surgery is still not there. So there has to be some form of surgery, where I said you can do a breast conserving surgery. And one more thing is that not every breast cancer patient, person diagnosed with the breast cancer, has the same kind of treatment. So for everyone, the treatment is different. This is dependent upon the patient's age, the tumor biology, the stage at which we detect them. These are all the factors that tell them how we are going to go about with the treatment. But still, at the end of the day, if it is early stage or if it is ER/PR positive, we say there are other lot of things regarding the receptors and the tumor biology. In those things, we do surgery first. The others we try to first give them chemotherapy, reduce the size of the tumor, and then just remove that remaining area. Sometimes it's clipped, sometimes there is a residual tumor that is still there, which is palpable. We try to remove that and check if there is any tumor cells remaining or not. So till now, there is no, there's nothing that I could say, okay, we can avoid surgery. Not really, not at this point.
Absolutely. Another question is, Doctor, are there any vaccines? No. The vaccines that is there is only for cervical cancer prevention and for no other malignancy as yet. That's also basically for prevention from HPV infection, but for breast, nothing.
Yeah, so like one said, it's for the gynecological tumors we have a vaccine, but for breast, it is still under the trials are going on, but we haven't yet reached to a point where I can say there is a vaccine that can cure your breast cancer or can prevent you against breast cancer. Abhi tak to kuch nahi hai. We need to give it more time until the trials are out. Yeah.
I think now we'll draw the session close if there are no further questions. And thank you everybody for joining us and being with us today.
Thank you.